Well, you may already know this, but if you didn't, February is Heart Health Month. And believe it or not, most of us could do a much better job when it comes to knowing our heart health IQ and taking better care of our hearts in general. Lucky for us, we are joined today by an expert who's going to help us do just that. Dr. Sharon Mulvagh is director of the Women's Heart Clinic at Mayo Clinic in Rochester, Minnesota. She's here to educate us about heart disease and how we can cut our risk of developing the condition and tell us about a project that can help bring it all together for us. Dr. Mulvagh, welcome. It's a pleasure to have you with us.
Thank you. Great to be here.
So, Doctor, let's start off with the latest statistics. What are they and what's happening in America when it comes to heart disease?
Well, heart disease is the #1 killer of both women and men. Indeed, 1 in 3 of us will die of heart disease. Over 600,000 people die of heart disease each year. That's about 1 every 40 seconds. The important thing is that women actually exceed men in the death rate for heart disease, and that's been going on since the mid-1980s. But women aren't aware of this. Indeed, only about 60% of women do know that heart disease is the #1 killer of women.
Okay, wow. So awareness is obviously an issue. So what needs to be done here? Is it awareness? Is it action? What needs to happen?
Well, you got to have awareness to then be able to take action. So I think it's a double-pronged there. Certainly, we need to continue to increase the awareness that heart disease is the #1 killer of women. And we also need to enable folks to understand that, in large part, heart disease is preventable. Over 80% of heart disease can be prevented by making good choices in our lifestyles. And this means leading a heart-healthy life by having good dietary choices and physical activity, having a healthy body weight, and not smoking.
Okay, those are all things that we should be doing, and now I understand that there is a project that can help us make that all happen, right?
Yes, the Heart Project has just launched, and this is a great project that has been undertaken by Progresso Soup in support of Mayo Clinic to increase and educate the awareness and also enable steps to take action so that particularly women will understand their increased risk and be able to do something about it.
Okay, that sounds like a great project, and I understand that part of that project involves a quiz.
Yes, and the quiz, it's a fun quiz. We call it the Heart Health Quiz, and the purpose is to determine your heart health IQ. And the quiz is composed of about 10 questions that really focus on what a heart-healthy diet is, as well as how much physical activity, how stopping smoking can reap benefits, how much sleep you need, and also understanding a bit about family history and how that can impact on your risk for heart disease.
Okay, sounds like, again, a quiz that all of us should be taking. And, Doctor, I'm wondering, where can people go to get more information about this project and about heart health in general?
Theheartproject.com, it's all one word, theheartproject.com, is the website where you'll be able to access the heart health quiz and determine your heart health IQ. And then there also are links to Mayo Clinic sites where you can drill down more specifically and determine your cardiovascular risk. There are a lot of very useful links to sites that can give you more information on making your heart healthy choices and being able to encourage you to head in that direction. You know, it's really small steps that really will make the big difference. We like to think of this quick formula. It's 5, 10, and 8. Try to take in 5 fruits and veggies a day. Try to walk just 10 minutes more extra or move 10 minutes more extra in a day. And also try to get those 8 hours of sleep at night. Those are pretty basic things that we can all start with today. And it's Heart Health Month, and it's really important to get started and be able to have the conversation and take the initiative to make your heart healthy.
Absolutely. Well, good to know that small things really can make a difference, and why not do it during Heart Health Month? Dr. Sharon Mulvagh of the Women's Heart Clinic at Mayo Clinic, we thank you so much for your time today and for being with us.
Thank you so much. It was a pleasure.